Welcome, everyone. In the next few minutes, I would like to present to you the results of my scientific work in the past 3 months. The title of my PhD is Correlations of Temporomandibular Disorders with Body Position and Posture. My name is Dorottya Német. I'm a physiotherapist and a first-year PhD student. I am working at Bajcsy Zsilinszky Hospital in Budapest, and my supervisors are Sandra Körmendi and Máté Jász, and my scientific methodology supervisor is Cindy Kian. My vision is to improve diagnostic accuracy and quality of treatment for patients with temporomandibular disorders, and my mission is to explore physiotherapeutic interventions for the management of temporomandibular disorders in affected patients. I am working on 2 main projects using the methodology of a systematic review and a meta-analysis for the first one, and the methodology of a clinical trial for the second one. The title of my first project is Investigating the Prevalence Rate of Forward Head Posture among Patients with Temporomandibular Disorders. Temporomandibular disorders affect 2.7 billion people worldwide. There's many variations of this condition, but the common in different types of TMD is the pain, the joint clicking, and limited jaw movement, causing discomfort for affected patients and impacting quality of life. We distinguish predisposing, initiative, and maintaining factors, and you can see that the muscle tightness is presented in all. That's because the anatomical background of this area, the temporomandibular joint, is connected with the cervical spine and the shoulders through ligaments and muscles, so we can hypothesize that posture problems may influence the development of temporomandibular disorders. Forward head posture is when the head is leaning forward out of neutral alignment with the spine, causing disbalance in the cervical area and in the shoulders. This condition is increased among students and office workers and projected to increase by 32.5% globally by 2050. At the end of the background, we can say that many patients sit only in dental chair when they should be seen by a physiotherapist too, so my aim is finding out if there's a correlation between TMD and FHB. Let's see my clinical question. Is forward head posture more common in patients with temporomandibular disorders? The main outcome will be the prevalence of forward head posture using 2 main angles, like the craniovertebral and craniocervical angles, and as a secondary outcome, the interpupillary line. My hypothesis is FHB is more common in patients with TMD, and the clinical implication of this project is more effective treatment outcomes and less suffering for patients affected with temporomandibular disorders. Here you can see my key articles, and the strength of these articles is the same diagnostic methodology for temporomandibular disorders, and I have found the previous meta-analysis, but it's from 2006, so I think that a revision of this topic is needed. Here you can see my search key. I have 2 domains. One stands for the temporomandibular disorders, and the other one is for the posture problems. I was searching in 4 databases, and I have found 2,731 articles, and after the duplicate removal, we had 1,664 articles. And my co-investigator and I finished the title abstract selection, but unfortunately we have several conflicts, so we have to rediscuss the criteria. The title of my second project is Comparing the Effectiveness of Online versus Face-to-Face Physiotherapy of Temporomandibular Disorders. Dentists and physiotherapists have two options for the treatment of temporomandibular disorders. It's the splint therapy and the physiotherapy. Right now, the gold standard is individual physiotherapy, which contains manual therapy and active exercises too. Regarding that, not many dentists and physiotherapists are an expert in this area right now. Patients have to wait for months or in several cases even for years for their treatment. There are reviews about the effectiveness of e-health and online platforms, which are promising for professionals. And thanks for the internet and social media, patients can find relevant information about their condition while they are waiting for their treatment. In view of this situation, my aim is finding out if online or group physiotherapy are as efficient as individual physiotherapy. My clinical question is group or online physiotherapy as effective as individual physiotherapy? The main outcome is pain using the visual analog scale and the pain-free mouth opening. My hypothesis is group and online interventions are not inferior to individual treatment, and the clinical implication of this project is to improve the efficacy of treating patients with temporomandibular disorders. We will include adult patients with myalgia only, and we will use the diagnostic criteria for temporomandibular disorders, and we will exclude all systemic rheumatic diseases, children, trauma, and patients with jaw surgery. We have not decided the sample size yet, but we had a meeting with an expert, and if we won't find any similar articles which has no mixed group in it, then it will be a pilot study, and we will work with 30 patients in each group. I would like to end my presentation with a quote by Albert Szent-Györgyi: raising a good problem, asking a good question, that's half of the job. Thank you for your kind attention.
Thank you, Dorottya, for your very interesting presentation. And the discussion is open. Sorry, Katinka at first, and then György.
Thank you for your presentation. I would like to ask you, how is interpupillary line and TMDs associated?
Thank you for your question. The interpupillary line can be affected in conditions like midline deviation or muscle imbalance, or in the changes in head posture or the condylar position. And some of these conditions can cause TMD. So based on our hypothesis, we think that the change in the interpupillary line can be measurable and significant in some cases of TMDs.
Thank you.
Thank you.
Thank you very much. It was a beautiful and brilliant presentation.
Thank you.
I was wondering about the TMD patient management. How do you see this field in the future?
That's a very interesting question. Thank you. Right now, we can say that, as I mentioned, not many collaboration or cooperation is presented between dentists and physiotherapists, and it's more rare in the private practice, in physiotherapy and in dentistry too. So I think it will be a long-term work and long-term goals to make a closer cooperation between dentists and physiotherapists. And I think we should promote the importance in the private practice, because in my opinion and what I can see among physiotherapists in the private area, they have a strict opinion about their treatment methods, and they are not really prone to collaborate with any other doctors, not only with dentists. So I think it will be a very hard work, but we have to work on it. Thank you.
Thank you very much.
Yes.
Is there not a risk? My question is joined to your second project.
Yes.
Is there not a risk of the misdiagnosis or the mistreatment based on the internet source? Because I am afraid if the patient practice the exercise on the wrong way, it's make a bigger problem than the original problem.
Yes, thank you. I understand. And before the home physiotherapy or the home program, there will be an appointment with us, with the dentist, and with me, so we can discuss it. And the online group will have a very exact and well-prepared video group which we will take. So we hope so it will be enough.
Mm-hmm. Okay, but this point is missing from your presentation, this pre-consultation with the video or home.
Yes, it's important that there will be a pre-appointment, of course.